Good morning, good afternoon, good evening to everybody. I'm so sorry that we haven't been able to connect live, and I appreciate your patience. And I want to just express how humbled I am to be speaking today to this group. First of all, I always say this to everybody, but I think the Encephalitis Society is the best patient-run organization out there. I think they do just a tremendous job. And that's not just because I do neuroinfectious diseases, but I think it's really just a fantastic organization. And as a caretaker of individuals who have neurological disorders, not encephalitis, but other conditions, I really recognize how hard it is to step out of the daily struggles that you existed in your life when you've been impacted by encephalitis and other neurological conditions. And I just want to thank you for doing that, because without you as an entity, the Encephalitis Society, we wouldn't be here today. We wouldn't be able to understand how to prevent, diagnose, and treat infectious and autoimmune encephalitis in the way that we need to, and do a lot of work going forward. So thank you. So I'm going to speak today on an overview of infectious encephalitis, and we heard from Sophie on an immune-mediated encephalitides. And I'm going to focus on those that are caused by arthropod-borne viruses. The following are my disclosures. So I want to start by saying that I'm half British. My mother was British, and I recognize that as an American with some British sense in me, I mispronounce a lot of words. And one of those words is encephalitis, which I use a soft C, but the proper way of saying it from the Greek encephalos, meaning brain, is encephalitis. So I apologize as I say this that I'm going to be using my kind of my United States terminology and pronunciation. So let's start with some definitions. So arthropods, interestingly, encompass a huge array of species, but we're really focused today on mosquitoes and ticks, and there are a huge number of families of ticks and mosquitoes that can cause encephalitis. And hopefully I'll prove to you today why we should really be concerned about these, that we should be aware of them, that we need to study them, we need to prevent them if we have vaccines, because they really are risks for emerging and re-emerging outbreaks. So these are just some of the arthropod-associated encephalitides. So these are encephalitis categories that are caused by ticks and mosquitoes in specific regions oftentimes, although I'll talk about environmental changes and how that's impacting the distribution. This is a very large, kind of complicated table from one of my favorite neuroinfectious disease doctors, Dr. Solomon. And this is a review article talking about flaviviruses, which is a kind of category of arthropod-associated viruses, and how many have kind of selective, meaning that primary neurological involvement, most commonly within encephalitis. And you can see in these red boxes, there's really a huge number, over half. So when we think about this category, we also think that, oh, they're more likely to kind of have neurological involvement than other, respiratory illnesses, et cetera. And then this is a map just showing some of the viral causes of encephalitis that are caused by ticks and mosquitoes. So things like in this blue area, Japanese encephalitis, tick-borne encephalitis virus, which is predominant in the European region. And then many, but here is highlighting Eastern equine encephalitis. We have Powassan virus, West Nile virus that is in the Americas. So why should we care about arthropod-borne infections as a group? As those of you who are survivors or know people who have suffered from encephalitis, and maybe some of you have suffered from these serious conditions caused by ticks and mosquitoes, I want to really emphasize today that we think of pathogens, we think of infections that are potentially emerging in populations that can cause serious illness. We think about this category a lot, and I personally get a lot of concern about it as someone who has this special area of interest. So this is a map that's written and drawn by Anthony Fauci here in the United States. Many of you know from kind of COVID, and He's been the spokesperson around a lot of COVID-related activities here and elsewhere. And you can see here that in this map, which shows emerging, re-emerging, and deliberately emerging infections, we have a number of neurological conditions, including Powassan virus, West Nile virus. We had Nipah virus, which can cause an encephalitis. And of course, we're in the midst of a pandemic. Luckily, we have vaccines that have been rapidly deployed. Still major gaps with that, but we know that we don't want to have another pandemic. We don't want to have another serious outbreak where we see neurological involvement. And so this area, I think, is a focus and should be a focus for many of us. So how do arthropod-associated infections emerge or re-emerge? Like, how do they start off kind of spreading in society? And so there's various factors, kind of three main categories. One is the environment, and I'll speak to that. There's individual factors. Sophie spoke about her research with respect to kind of some genetic or immune mediated factors of the individual that's affected. And then there's certain components of the virus that make it more likely to actually cause encephalitis. And there's still a huge amount of ongoing work with respect to these categories. I cannot emphasize enough, and I think one of my kind of main areas of interest is how climate change is going to impact and continues to impact human health. But this will be, I think, an incoming crisis that will infect populations that are at risk for encephalitis going forward, as well as many other conditions. So this is just a diagram showing all of the different conditions that we think may arise further because of climate change, including factors such as weather extremes, rising temperature, rising sea levels. That's not just related to mosquito and tick-borne infections, but also waterborne diseases, also cardiovascular diseases, psychiatric issues as well. And we're on the heels of COP26, which I think made some headway with respect to climate-related factors, but really hasn't seen the targets that we really need to stabilize and reverse what's happening to the earth. And why this is so important with arthropod-associated infections is that we have changes that affect the behavior of the mosquito or tick, and we have an expanded geographical range. So essentially, these mosquitoes and ticks can infect humans in different areas where they previously did not. And this is oftentimes a high risk for symptomatic infection because it's individuals who may not have been exposed to it so much when they were children or young adults. We also have the factors of populations migrating and emerging into kind of more urban populations and having more of a kind of animal-human interface that is, a serious player. It was a serious player or is a serious player in COVID, and certainly with tick-borne infections, it is as well as mosquitoes. So just to give you some examples, there's really what we've seen is real-time impact on climate change with the recent outbreak of Japanese encephalitis that has been identified in Australia, in which it's emerged locally for the first time. And it's thought that this is due to record-breaking rainfall, flooding, and warm temperatures in the region. And this is an article that I urge you all to read. It's one of a patient that was suffering from Japanese encephalitis. This is transmitted by a certain type of mosquito that has been previously bitten by an infected animal, such as a pig or water bird. And this is really the first outbreak, as I mentioned, from mainland Australia, an example of this spread that we see with respect to climate change. I also want to emphasize that it's not just really direct effects of climate change, but it's also war that we see the risk of outbreaks and emerging and re-emerging pathogens be of particular concern. So we unfortunately are seeing the devastating effects of the war on Ukraine with millions of individuals, including thousands and thousands of young children who are refugees now in areas of Eastern Europe. Those children likely are missing significant amounts of their vaccines. They're living in enclosed, populated conditions, oftentimes outdoors, as is seen in this image from the New York Times. And why is this relevant to encephalitis? So we think about in the area of Eastern Europe, including Russia and Poland, Ukraine, these countries have high rates of what we call tick-borne encephalitis virus. And there was actually a systematic review done by Ukrainian physicians on the incidence and prevalence of tick-borne encephalitis virus in the country. So how much tick-borne encephalitis there was. And there's a significant amount in the region, although it hasn't been really well studied by kind of smaller studies. Why is this important right now? Because this is the recommendation on this kind of right-hand lower side of the schedule of doses of vaccines that are to be administered so that there can be prevention of tick-borne encephalitis virus. And as you can see here, there's a protocol for children and then adults who are mainly travelers if they haven't had their kind of early vaccine series. One thing I think we really need to be involved in as the Encephalitis Society is ensuring that the children who are refugees, especially going into the summer months, have been adequately vaccinated. So going into how viruses cause encephalitis, kind of in very general terms, there is parts of the virus that has material, so components of it, then could promote entry and then subsequent spread into various parts of the brain. So Sophie showed you an image of limbic encephalitis that affects the temporal lobes, but there are many different viruses that cause kind of areas of the brain to be affected. And then there's also certain proteins that are part of the virus or that are kind of like coded by the virus that allow it to reproduce and hide from the immune system. And that's so critical because that allows for not only the survival, but also the propagation of the virus in various parts of the brain. And this will get to kind of what Sophie was talking about, as well as potential treatments as well. So the way the virus can enter the brain can also be a therapeutic target. And so when we look for vaccines for certain conditions like COVID, or we look at tick-borne encephalitis virus vaccines, we're looking at structural parts of the virus itself that we can target that will minimize the effects, right? That will kind of block that entry into certain parts of the body or into certain cells. And so there are certain parts of tick-borne and mosquito-borne viruses that are being targeted that we're looking at now that are really kind of exciting at the frontiers of what we would say for vaccine development. So what about us? So your immune system is a great thing, right? Because when an infection or pathogen goes into your body, your immune system, your innate immune system, which is kind of like that rapid response fighters, will come in and they will try to kind of subdue the process. And then you have another kind of component of your immune system, the adaptive immunity, which is this more kind of long-term effect that your body remembers the infection and will not have it again or will be protected from it. Now, there's certain parts or aspects of the immune system, including certain factors like how it looks or receptors, genetic components, for which it kind of goes awry and it doesn't attack the pathogen in the right way. And so then the pathogen just kind of goes around and can spread to the brain. And so this is also a really key component, along with the factor of the virus itself and global climate change and environmental factors. So what about some of the patterns that we see with arthropod-associated encephalitides? And so essentially all these pictures here, these brighter areas that you can see are areas of abnormalities. What's really interesting about this category is that a lot of the patterns that we see across different viruses, so things like Powassan virus and West Nile virus and tick-borne encephalitis and Japanese encephalitis virus is shown here, they like to target certain areas. And that is because we think from kind of mainly mouse and animal studies that they take certain pathways across certain areas and cells of the brain that give it like this love for certain parts of the brain. And then those parts of the brain that are affected will then give clinical symptoms. So things like your memory being impaired, or certain abnormal movements, certain difficulties with your speech. So this is why we see kind of the symptoms that many of you have unfortunately been impacted by, and that can also impact people longitudinally, right? Because there can be damage to those areas that are long lasting. Some with, critical rehab, which is like the most important thing I think in neurology, can really be repaired, right? The brain can relearn. It's an amazing organ. And then by no means do I want you to kind of understand these slides. But what we see here is we see a lot of, when we kind of look at the brain, unfortunately, of individuals who have died, or in animal models of encephalitis, we see a lot of inflammation. We see damage to certain cells. And again, across different types of arthropod-associated encephalitis, we see a very similar pattern. Sometimes we can detect the actual virus itself as well. So I think a critical component of what I want to talk about is how much we can really leverage and learn from COVID-19. Certainly, it's a primary respiratory virus that has neurological involvement, but the predominant studies, including ours, really did not identify that there was direct neurological involvement. So there was not a florid encephalitis, infectious encephalitis from COVID-19, but there is effects from an inflammatory component. What's incredible about COVID-19 and the pandemic, and unfortunately very, very sad because it's been so devastating, is this acceleration in treatment and prevention development. So we know there's been rapid record pace for vaccine development and deployment. But if you think about the therapies that have been developed in less than 2 years, when we knew nothing essentially about COVID-19, there's been over, if you just look at these numbers from the Federal Drug Administration here in the United States, and there's also NHS related data, there's been over 50 or active antiviral treatment trials. There's cellular and gene therapies, over 60, over 120 immunomodulators, so things like steroids and tocilizumab, which you may have heard about, neutralizing antibodies, over 60 have been evaluated. And then in kind of this other category. So what can we do? I think we've been, I will say, and I think this is my honest kind of opinion, I think we could do more. We need partnerships. We need the Encephalitis Society. We need to have multi-site studies, large scale, because encephalitis is an unusual condition. It's a unique condition, which we don't see every day. It's not similar to stroke, where I see a case of stroke 3-4 times a day. I see encephalitis maybe once a month, once every other month in a busy hospital center in New York City. We need to come together as a group, multinationally, I think, and really be aggressive about the studies that we do and do more randomized controlled trials. And we shouldn't only directly treat the virus. That's a component that we need to do, as it is for COVID-19. But we also need to look at monoclonal antibodies. And people like you that have had the virus or have had an infection or an immune-mediated process, studying you actually can be so beneficial for us to understand how to use these treatments for people in the future. We can use IVIG, which there's been studies on, steroids. I think the biggest category here is how we attack the immune system. How can we control the immune system and that kind of florid response to encephalitis? And how can we do it in the right amount of time, right? Because oftentimes people are presenting later or being diagnosed later for an infectious encephalitis. So how do we really target this? And I think we need to learn from COVID-19. There's so much we can draw from in terms of the drugs and treatments that are being used. I want to, Sophie gave a brilliant talk on immune-mediated encephalitis. I want to emphasize that there is this connection between infectious encephalitis and immune-mediated encephalitis that we're learning more and more about. It's not just the early story of herpes simplex virus encephalitis triggering predominantly an MDA, but now, and this is just a table, it's a bit messy, of a series of pediatric patients who developed positive NMDA encephalitis with recurrent symptoms after Japanese encephalitis virus. And so oftentimes we're switching from thinking about the primary infectious process, but when someone comes back into us, now thinking about, okay, how can we look at the immune system and its reaction, and how can we treat it? And I think this is a huge area that we need to also continue to investigate. This is just an image from one of the patients in that article. This was a pediatric population. And you can see here these bright areas, which are in the kind of central part of the brain, the thalamus. And then you can see here, this was actually 3 months after the primary Japanese encephalitis. You can see here that there's ongoing kind of inflammation, actually new inflammation, because this had receded and then this came up, and this ended up being positive for NMDA in the CSF. So I hope that I have convinced you in this short amount of time that arthropod-borne encephalitis are a major public threat with significant risks associated, I think, primarily with environmental changes. While there are a large class of viruses that can be transmitted by mosquitoes and ticks, there's really significant similarities in terms of what they look like, the patients look like, what their imaging looks like. That can give us information about the mechanisms by which these encephalitides emerge. There are now, I think, lots of evidence that there's many factors, right? This is complicated in the development of encephalitis, both from the virus or pathogen itself, as well as from the person who's been directly affected. But people like you, I think, are really where we should look to for potential therapeutic targets. We need to really further understand the immune pathways that implicate what we see in those tissue, like the brain images that I showed you, to really understand the role of how we can modulate, how we can kind of tweak the immune system so that encephalitis maybe be subdued or it doesn't happen at all, which is, my real primary goal. So, as I mentioned at the beginning of this talk, I am so thankful to all of you as advocates, supporters, patients, and caregivers. I can't thank you enough. And just the fact that you're taking the time out of your busy schedules to be here, to listen to this, to be engaged, to support each other is really a true sentiment. And I would love to meet you in person. Hopefully I'll be in England in December. And for those of you listening globally, I'm available to answer questions, to talk about how we could collaborate in a kind of patient-physician collaboration, which I think is so fundamental. The Encephalitis Society, I've already spoken to just what I think. I mean, Ava, you run the best organization in the world. And thanks to my organizations, including Columbia and NYP, the WHO, which I do a lot of public health work with, and the CDC in the United States, which I work very closely with around projects on encephalitis, but also COVID-19 related projects as well. So thank you so much for your time.